we are building a next generation platform right now that I think answers your question. So we are building out dental medical intelligence platform and analytics tools for health plans and payers that will allow them to leverage dental data to detect, predict, prevent chronic disease.
Sounds amazing. Sounds complex. I don't know if I'm 100% comprehending, but I get it. You're just adding it to their whole healthcare. Welcome back to The Doers, the podcast where we dive into the real stories of building, struggling, and thriving in dentistry. I'm your host, Dan Hall. In each episode, we explore the challenges, victories, and lessons learned from those in the trenches shaping the future of our industry. Today, I'm joined by Sara, are you a founder or you're running?
No, I'm not. I'm the CEO of Digibyte Dental.
CEO of
Not
Digibyte.
the founding CEO.
Okay, you're not the founding CEO. Okay, well, we're going to get to that a little later because I have a couple of questions. But this is a platform where you are doing virtual consultations for patients that might need care and they need to talk to somebody right away, so we're taking care of the patient, but then also you're pairing up and you're matching them to practices that can provide that care. Did I get that right, Sara?
Yeah, that's right. So we started out as a Tele-Dentistry platform, and primarily since 2022, we've been serving health plans. Those are our main partners, dental plans. With Tele-Dentistry, we have 350,000 members on our current platform. And then, yes, we also can support, we're really excited about it, DSOs and dental practices looking to leverage virtual care for triage, new patient acquisition. And so that's how we're partnering with DSOs and practices today.
Well, thanks for sharing that. So I'm a little curious. I mean, it sounds like a really interesting platform. So if I own a practice, and I'm a simple person, so you might have to break this down for me.
Yeah.
Somebody does a virtual consultation on your platform. How do they get to me? Do I have to do that consultation, or what does that look like?
So we actually have a network of providers in 48 states. And so when our providers take a call, they're taking those calls asynchronously or synchronously. We have both. And when they ultimately need to come in, that patient ultimately needs to come in for a visit, then we refer to our partners for that opportunity. And so what that looks like is if you're leveraging virtual care, it's probably an emergency. You definitely need to be seen. And so the referral is a really high value one. And we're able to, folks are spending a lot of money on new patient acquisition for not necessarily guaranteed verified lead. And we're giving them a lead that a provider has already vetted for them. So they don't have to spend any time doing that, and they don't have to leverage their own providers in office for triage.
Oh, that's fascinating. So if I get that, it's coming to me and I know, like, hey, Dan did a consultation. He was complaining about sensitivity on his tooth to cold, probably a root canal, right? So those are the type of details that are going to get passed along to the provider that's ultimately going to see them.
Exactly. And it's a nominal fee. It's $250 per office and then $200 per lead. So if you have a root canal or a cap or something like that, that pays for the service in and of itself in spades. So we're just trying to offer that opportunity, not replacing your current marketing strategy, but coming alongside your marketing strategy and giving you the ability to say, I offer emergency virtual care right now without having to leverage your providers or your staff to do any extra work to get that lead in.
I love it. So you're just augmenting the process with some technology. So this way the providers that are in the practice are working with the humans that walked into the building, right?
That's right.
And sorry if I sound like a total tech nerd when I say human. So when I talk about technology, I love to just differentiate between the two. So their time is with the ones that have walked in, and then we're just queuing up the next behind that.
And they know how to plan for that visit because they know exactly, they have notes from the virtual visit from our provider for what that person needs, so they can plan and make sure they have the time set aside effectively for that. So really helping them maximize the revenue in the chair.
Very cool. So you're the CEO of a tech company.
Yes.
And you're working in dentistry. I'm curious, if you had a crystal ball and you're going to tell me what's going to happen in about 2 to 3 years, tech-wise, in the dental space or healthcare, what do you see coming down the lane?
So today, that's what we're offering is with the Tele-Dentistry platform. And Tele-Dentistry is going to be a big part of our future. But actually, we are building a next generation platform right now that I think answers your question. So we are building out dental medical intelligence platform and analytics tools for health plans and payers that will allow them to leverage dental data to detect, predict, prevent chronic disease. And so we're leveraging oral health data to change healthcare.
Okay.
Which is what we're really excited about and proud of.
Sounds amazing. Sounds complex. I don't know if I'm 100% comprehending, but I get it. You're just adding it to their whole healthcare mix.
So
look at a patient.
So we've known for over a decade now that if the risks for example, if you have carotid artery disease,
okay,
there's a really good chance that you have calcification that is a predictor of that shows up before you may have symptoms that your cardiologist would find. And so you go into the dentist and you get a picture, you get an x-ray because you need a root canal.
Okay.
And you might show signs of carotid artery of calcification, but the dentist isn't looking for that. So the conversation doesn't happen, and maybe you have a heart attack in 2 years and there were no warning signs. So we're saying there are, and that's just one example, across all the major chronic conditions, diabetes, hypertension, cardiovascular disease. We know, go to your dentist. If you don't, people who stay on top of their preventive care have better health and have less chronic disease risk and incidence rates. So let's actually put that into practice and leverage that dental data to change people's lives and catch something before it becomes a problem.
That's amazing. Sounds like a big project.
Yeah.
I mean, good for you all to tackle it. So let me just shift gears for a second. So what's your favorite book, podcast? Is there anything that's helped you get to where you are today as CEO of this tech company in the space in healthcare, taking on a really large project? You got to have something that you go to help you just like sharpen your skills.
Sure. So I would say in terms of things that have really shaped, well, my background, by the way, was not in healthcare directly. I have a master's in industrial organizational psychology. So I started caring about health at work. That basically means we care about the employees that work for our companies, and we believe that their well-being might be impacted by their work.
Okay.
And so then made my transition over into healthcare from there. And so the things that keep me inspired are actually, you said humans earlier, human stories.
Okay.
The distilling it down to, if we're going to solve big problems, we need to understand that real humans are being impacted by the problems that we're designing solutions for. And so my favorite thing to do when I come to a conference like this is to talk to people, talk to them about, do they have, what is their healthcare experience? What is a time that they felt really cared for or not by a provider, and really listen to those stories. So I think more than a thought leader that I would buy a book from or listen to a podcast, I learn the most from just listening to people's stories.
I love it. It's one of my favorite things too about these conferences, right?
That's what you're doing right now.
Exactly. We randomly bumped into each other and started talking, and now here we are doing an episode, which is really cool. So what do you do to unwind then? So, I mean, you got to be busy, running a company, both healthcare and, now into the vertical dentistry in that space. What's your go-to to disconnect for the day or at the end of the day?
Oh, okay. So at the end of each day, my favorite thing to do, my everyday thing, I have two answers to your question. My everyday thing is cook dinner. Chopping a vegetable just is euphoric for me at the end of the day. There's nothing like preparing a meal for yourself, right? And just like getting into that creative process and doing something nice for yourself. But I was going to say, before you said, what do I do at the end of a day? Because you can't do this every day, I'm actually a diver, a scuba diver. So, we're always getting hit with all this stimuli, right? And there's absolutely zero annoying noise underneath the ocean.
Oh, yeah, that's very cool.
Yeah, it's just like
totally go into silence.
Deprivation chamber, except for the beauty of all the little fishes.
Oh, very cool.
Yeah,
Thank you for sharing. I appreciate it. And Sarah, thank you for joining me as well, too, and tell me the story and what you guys are out there working on. What is the best way if somebody's curious about what you're doing and wants to connect with you? How should they reach out?
So you can find me on LinkedIn, even though I have a really normal name. So I'm Sara Martin, but the easiest thing is to go to digibitedental.com, and we have a contact page, and that goes straight to me or to someone on our growth team, and we'll reach out to you, and we'd love to connect.
All right. Well, awesome. Again, thanks for taking time as we're here at Inner Circle to sit down and have a chat.
Thank you.
All right. Those listening and watching, if you like the content, keep following us. And until next time, keep doing the work. Awesome. Thank you, Sarah.